Hello, my name's Sarah Cleveland. I'm a professor of comparative epidemiology at the University of Glasgow. We face quite considerable challenges in trying to get accurate and reliable data on causes of livestock mortality and losses in Africa. Most of the data that we have are related to passive surveillance. That means people reporting cases to the authorities, and much of the data relates to farmer reported cases of disease and death. And while farmers are very familiar with a number of diseases, the degree of reliability can vary quite a lot between different settings. And there are some instances actually where farmers consider a situation to be kind of normal background. So for example, if they lose young sheep and goats through abortion losses, for example, they often consider that to be a sort of normal feature, and they wouldn't necessarily report it as disease. One of the other problems we face is that people will only report diseases using terms that they're familiar with and that terms that already exist in the language. And as we've been doing more and more studies, actually identifying through laboratory diagnostics the causes of these diseases, we're picking up some new disease agents that people probably are not familiar with at all in terms of their traditional language and their traditional cultures. One of the other challenges we face in terms of data from a lot of the surveys that are done is that we often just get a single snapshot picture in time of the disease situation, and we know that it's a very dynamic situation. Some diseases occur as sort of sporadic epidemics, others are more continuously present but also show a lot of seasonal variation. So it's really important that we're able to capture some of this dynamic nature of disease impacts, otherwise we may end up sort of generating misleading information and targeting interventions inappropriately. But this is going to be quite challenging because the livestock systems which we're working in are also changing very rapidly. There are huge pressures on land, there's change in grazing systems, there's a move towards improvement of breeds, towards intensification, modernization, and these are all going to have major impacts on disease prevalence, disease risks, mortality rates over the coming years. So we also have to be careful not to be introducing an intervention that might have been appropriate 5 years ago but actually is less relevant to the current situation and addressing the current needs of livestock dependent communities. In human health, much of the data and the evidence that forms the basis for a lot of prioritizations and interventions have been built up over many, many years through very detailed longitudinal data collection of the demographics of people in different communities. So that's birth rates, death rates, different causes of disease, different causes of death. For these systems, we have data from a lot of communities from around the world. And this has formed absolutely critical evidence in determining which diseases are most important in which communities, and then potentially which interventions we might introduce, and provides a platform also for us to evaluate the effectiveness of those interventions. For livestock diseases, we have nothing at all equivalent to this, but I think there are huge opportunities for linking up with those human health platforms, they're called the demographic surveillance system platforms, to bring in a component of animal health information gathering and also basic information about livestock deaths and births. It would also give us an opportunity not just to look at the causes of disease and mortality on top of that, but also to evaluate the outcomes of any interventions in terms of human health and other factors associated with sort of household economics, prosperity, well-being, educational attainment, for example. So I think there's huge opportunities there that we could probably investigate a bit further, and we wouldn't necessarily have to go and create new systems right from the outset.